Hi, my name is Danielle. I'll be your student nurse today. Can you tell me your name, please? And your date of birth? I'm just going to take your bracelet. Do you know why we're here today? Do you know where you are? Do you know what time of day it is? Patient is oriented to person, place, time, and situation. My name is Danielle. We're going to be doing a health assessment today. It shouldn't take too much of your time. I'm just going to be listening and feeling. If you have any questions along the way, just let me know. We're going to start by taking your vitals. Does it matter which arm we take the blood pressure on? Okay, let's do this side here. Okay, I'm just going to pump up the blood pressure cuff on your left arm. Okay, blood pressure is good. Let's get your heart rate. Patient's heart rate and respirations are within normal range. We'll get your pulse ox on your right index finger. SpO2 is 99, which is good. Do you know how tall you are? And how much do you weigh? And are you experiencing any pain today? From a scale of 0 to 10. 0 being not that much, 10 being excruciating pain. Patient does not say that he's in pain today. Okay, we're going to start. I'm just going to be doing a general inspection of your whole body. Patient appears to have good hygiene. Patient's skin color is normal for his ethnicity. Patient's body stature and posture is good. Patient's mobility was good as I observed the patient walking in. Patient looks well nourished. We're going to now start the head to toe assessment. I'll be first looking at your head. I'm looking at your hair. Your hair looks well distributed. The contour of your scalp looks good. The texture of your hair is good, so you look well nourished. I know the facial features. Your eyes, nose, mouth, and ears all look symmetrical. I'm looking at the bony structures of your face. Everything looks symmetrical. Skin is intact. No cuts, abrasions, lesions. Skin color looks good. I'm now moving down to your eyes. Do you normally wear glasses or contacts? Good. Now I'm just looking at your eyebrows. The hair is distributed well. The skin looks good. The eyebrows are symmetrical. Your eyelids and eyelashes are symmetrical and positioned well. I observe that you're able to blink and close your eye well, and the color of your eye looks good. I'm now going to be looking at your eye. The sclera of your eye, the white looks good. The clarity, I'm looking at I'm going to inspect the cornea for transparency. Good. Your eye movements look symmetrical when you move your eyes. I'm now going to check your perilla, which is your eye's reaction to light. So I'm going to have you look at my pen light here and just look straight ahead. And now I'm going to have you follow my pen light without moving your head, with just your eyes. Very good. Patient's pupils are equal, round, and react to light and accommodation. Patient's cranial nerve, the oculomotor, trochlear, and abducens cranial nerves are intact. Can I have you smile for me and frown? Blow up your cheek. Clench your teeth. Good. Patient's facial cranial nerve is intact. We'll now move down. I'm now looking at your ears. Your ears do look to be aligned and positioned well. The size of them is good shape. Your ears do look symmetrical. Skin is intact and skin color looks good. I'm now going to inspect the external ear. No discharge or lesions. I'm now feeling your lymph nodes. Lymph nodes do not feel to have any swelling. Patient denies tenderness or pain. I'm now feeling the external ear and feeling the mastoid process. Patient denies tenderness or pain. I do not feel any edema or nodules. I'm going to now look down lower to your nose and mouth. Your nasal structure does look aligned with your face. Your septum does not appear to be deviated. I'm now going to look up your nose for patency. In the permanence, I do not see any discharge. I'm looking at your lips now. Your lip color looks good. I'm going to have you open up your mouth for me. Patient's oral mucosa is pink and wet. Patient's teeth are present. The gum color looks good in the texture. Patient's teeth are white and in position or aligned. Patient appears to have good oral hygiene. I'm now looking at the hard and soft palates. The color looks good. I do not detect any odor. The anterior and posterior pillars are present. The uterine tonsils are present, and the posterior pharynx looks good. I'm now looking down at your neck. Your trachea looks aligned. I'm now going to have you move your neck around. We're going to test your range of motion. Have you put your neck down, up, to the left, and to the right. I'm going to have you push against my hand here for resistance. And now back to the other side. Patient's range of motion is good with resistance and gravity. I'm now going to palpate the carotid pulses. I'm going to do one at a time because if I do those at the same time, it'll cut the oxygen off to the brain and the patient will faint. And feeling for amplitude. Carotid pulses feel strong and regular. I'm now going to auscultate the carotid. I'm going to lift your head and turn it to the side. Okay, and now the other side. Patient's carotid did not sound to have any bruise or swishing. I'm now feeling, again, a pure lymph nodes. Let's have you lay down for a minute. I'm going to check the jugular vein distension. Have you lift your head and turn to the side. And lift your head and turn to the side. Patient is negative for jugular vein distension. I'm now going to look at your arm. Patient's arms do not appear to have any deformities. They do appear symmetrical. I'm going to feel around on your arms, elbows, and wrists. Temperature is equal throughout. Patient denies any tenderness or pain. I'm now going to palpate the radial pulse. Now the radial pulse for amplitude. Patient's brachial and radial pulse were present and strong and normal. I'm now looking at your hands. I do not see any abrasions or scars. The temperature feels equal throughout. There's moisture in the hands. The hands appear to be symmetrical. I'm going to just look at your nails here. The contour consistency is good. The color is good, and the patient appears to have good hygiene of the fingernails. I'm going to test the capillary refill on the left index finger. Capillary refill is less than 2 to 3 seconds, which is normal. I'm checking for clubbing of the fingers with the 2 index fingers. Patient doesn't appear to have a gap, so negative for clubbing. I'm now going to have the patient turn around. I'm looking at the posterior chest. Skin is intact, no scars or lesions. Patient's shoulders are symmetrical, scapular placement is symmetrical. I'm now going to check for respiratory depth. Let me have you take a deep breath for me. And now let me have you lean forward a little bit. I'm palpating the spine. The spine does not have any curvature and appears to be straight. No scoliosis. I am now going to also take the posterior lateral chest fields for breath sounds. Take a deep breath. Again. 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 And now listen for the lateral breath sounds. Deep breath. And deep breath. Patient's posterior and anterior lung sounds are clear. I'm now going to have the patient lay down. I'm now assessing the abdomen. I'm just looking. I don't see any scars or lesions or no bulges. The navel is aligned and the chest is symmetrical. I'm now going to auscultate all 4 quadrants for vowel sounds. I'm not going to use the bell and listen for bruise or any venous hump. Patient's vowel sounds were active in all 4 quadrants, and I did not hear any bruise or venous hums. I'm now going to palpate all 4 quadrants for tenderness. Let me know if you feel any pain or tenderness. I do not feel any masses or guarding. I'm now going to percuss in all 4 quadrants for fluid in the abdomen or floating masses. I do not feel any floating masses or fluid. It is dull in the upper left quadrant because of the liver. In the upper left quadrant is also the gallbladder, and the upper right is the pancreas. Lower left is the appendix. I'm now going to listen to heart sounds. I'm going to first listen to the aortic valve, which is on the left second intercostal space. On the right intercostal space. I'm now going to listen for the pulmonic valve in the second intercostal space on the left side. I now listen to the herbs in the left intercostal space. The tricuspid is on the left lower sternum border. I'm now going to listen to the apical pulse on the left mid-clavicular line on the fifth intercostal space, which is the mitral valve. The apex is heard the loudest. The S1 is heard the loudest at the apex, which is the mitral valve. The S2 is heard the loudest at the base of the heart of the pulmonic valve. We're going to move on now. Patient's apical pulse seems strong and regular with no dysrhythmias or heart murmurs. Patient I cannot hear an S3 or S4, so that's good. Let's move on to the lower extremities. I'm just inspecting your legs. I don't see any skin scars or lesions. Hair is distributed well. I do not note any deformities or vascular deficiency, no swelling. Patient's legs temperature is equal throughout. Let me check your popliteal pulse. Now I'll check your pedal pulse. And now your post-tibial pulse. I'm going to check your skin for tinting. The skin turgor patient is negative for tinting. I'm now going to test the range of motion in your leg. I'm going to lift your leg up, out, and in, and down, up, out, and in, and then down. Patient's range of motion is good. You have you lift your foot up against mine, lift your foot up against my hand. Patient's range of motion is good against gravity and resistance. Patient denies any pain or tenderness in the legs. I'm now looking at your feet. Skin is intact. Patient's temperature is equal bilaterally. There is moisture in the feet. Feet look symmetrical. I'm going to now look at your toenails. The shape, contour, consistency is good. The color is good. And patient appears to have good hygiene of the toenails. I'm going to take a capillary refill on the left great toe. Capillary refill is less than 2 to 3 seconds. I'm now going to test the remaining neurological systems of the patient. Sit up. While the patient was sitting up, I noted the patient's movement and coordination, which was good. The patient did not appear to have any problems sitting up or no dizziness noted. I'm going to have the patient walk to the other side of the room and back. The patient's gait appeared smooth with no stumbling or swaying. I'm going to now have the patient lean over and touch his toes. I'm feeling for alignment of the spine, and again, spine is straight with no curvature. I'm now going to do the Womberg's test. The patient will stand, and I will see if the patient is able to stand. If you close your eyes, the patient does not have any pain. The Womberg's test is negative. This completes my head to toe nurse's assessment. Do you have any questions for me? Okay, thank you for following me on Facebook.